It's Alicia Burke with Long Beach Local News, and today we're visiting the Division of Interventional Neuroradiology at the Comprehensive Stroke Center at MemorialCare Long Beach Medical Center. We're sitting down with Denise Roberts, a patient at the center, and her husband Mark to talk about her treatment here. We're also speaking with Dr. Reza Jahan to learn more about the center.
On August 11th, 2020, early morning, Denise had suffered a brain aneurysm, a stroke, and then multiple seizures. So she was rushed to the hospital that early morning, and that's when everything happened. From the moment we walked in, we had unbelievable treatment here. Like I said, from the minute I walked in, they told me what was going on, what was going to happen with Denise, surgery, that it was going to be a long surgery, a long day. They kept me informed, and they were unbelievable that day. She had a second surgery with Dr. Jahan about 3 months after her first surgery, to go back in there and do a second surgery, and it had been nothing but remarkable. We couldn't be more thankful or lucky. People did say, basically, if we ended up somewhere else, we don't know if we would be here today. And so, I thank God every day for the stroke team, Angie and her team. But yeah, to have that in our backyard, and like I said, we didn't have a choice where we were going to go, but it was in our backyard in here, and we couldn't be more lucky.
Denise suffered from a bleeding aneurysm. And let me begin with the basics a little bit. So an aneurysm is like an outpouching on a blood vessel, like a blister on a blood vessel. So a part of the blood vessel wall may thin out and get pooch out, and that thin-walled outpouching can then, even under normal blood pressure, can burst and bleed into the brain and give somebody a bleeding stroke. Now, there are many options to treat a brain aneurysm these days. You can certainly have traditional brain surgery, and that's a possibility for somebody young like her. Potentially, she can have open brain surgery. But we also have these other techniques, minimally invasive techniques for treating brain aneurysms, wherein we treat the aneurysm from inside the blood vessel. We enter the blood vessel from typically the blood vessel in the leg, in the groin area. From there, we navigate up all the way into the brain with small, tiny plastic tubes called catheters. And through those catheters, we can treat these aneurysms from the inside, filling them with soft metallic coils that basically block the inside of the aneurysm, preventing blood from entering, pushing on the walls, and causing any further bleeding. And this procedure is called an aneurysm coiling embolization procedure. We estimate that about 2 to 6% of the population has a brain aneurysm. And this is based on studies of the population and based on autopsy studies. It's somewhere between 2 to 6%. So it's not rare. In addition, we know that the rate of bleeding, like an aneurysm bleed that she had, is about 1 in 100,000. 1 in 100,000 in the United States. So not super common, but not uncommon either. Stroke is a general clinical term. It basically denotes sudden impairment of brain function. That's what a stroke means. All of a sudden, your brain is damaged for some reason. There's a problem with the brain. It could be from two things. One is bleeding, similar to what she had. The proper term for it is hemorrhagic stroke. The other type of stroke is from blockage of a blood vessel. When you block a blood vessel, you deprive the brain of nutrition and oxygen, and that part of the brain that is deprived of those nutrients then dies. The most important thing, of course, for the public to know is that if you are having stroke symptoms, it is very important to call 911 and get yourself to the hospital right away, especially with ischemic stroke and also with hemorrhagic stroke. Treatment is available. With ischemic stroke in particular, it has to be given very early to be most effective. So the faster you get to the hospital and the faster you get diagnosed with one or the other and appropriate treatment is instituted, the better your chances of having a complete recovery. An acronym that we tell people to remember to recognize a stroke and call 911 right away is the acronym FAST. It's simple. It's easy for people to remember that acronym. FAST. F stands for face. People with stroke will have a drooping face on one side or the other. So that's the F in FAST. A is for arm. Their arm will be weak or paralyzed. That is a very common symptom after a stroke. So that's the A in FAST. S is for speech. Your speech will be off, and there will be problem with talking or understanding speech. And speech is also a common symptom that people with stroke suffer from. And T is time to call 911. So that acronym FAST is something that we ask people to remember, and if they have or see somebody that is experiencing symptoms, call 911 right away and get yourself to the emergency room. It's been a great pleasure. Seeing people like Denise here make a recovery like this is a tremendous reward and tremendously satisfying for us. So being here and making a difference in the outcome of patients like Denise is tremendously satisfying.
For more information on the center, visit memorialcare.org/lbstroke. It's Alicia Burke with Long Beach Local News.